listening to 40 Weeks, a production of the Pregnancy Podcast with Vanessa Merton. Visit pregnancypodcast.com/week for all of the 40 Weeks resources and sign up with your due date to get each episode delivered to your inbox when you start a new week of your pregnancy. Thank you for tuning in to the 40 Weeks podcast. Welcome to week 7. You have 33 weeks to go. You can see a picture of what your baby looks like this week, read the transcript, and access the additional resources for week 7 at pregnancypodcast.com/week7. Your little sweet pea is now the size of a small blueberry. They measure 0.37 inches or 0.95 centimeters. And while that seems small, your baby is 10,000 times bigger now than they were at conception a month ago. At 7 weeks, most of the growing that your little one is doing is concentrated in their head. They're generating 100 new brain cells per minute. Your baby's arms and legs start developing more this week, and arm and leg buds are growing longer. The arm buds are divided into the hand, arm, and shoulder segments, and leg buds divide into the leg, knee, and foot segments. Your little blueberry has already gone through 3 sets of kidneys. The ones in place now are permanent and ready to begin their essential work of waste management. Your uterus has grown and doubled in size in the past 5 weeks. Your breasts are also growing. By week 7, many women have grown a full cup size. Early in your pregnancy, sensitivity, tenderness, and pain are common in your breasts. The soreness is caused by hormonal changes, retaining more fluids, and your breasts preparing for lactation. You may also notice that your areola is getting darker in color, and it will continue to do that throughout your pregnancy. The color contrast between the areola and your skin is actually a target to help your baby find the nipple at birth. This is just one of many changes that your breasts go through during pregnancy. One symptom that's very prevalent during pregnancy is constipation. This includes difficult or infrequent bowel movements, hard stools, and pain and discomfort in your stomach. Early on, your body has increased progesterone that relaxes your smooth muscles, including your digestive tract. So as your digestion slows down, your body has more time to absorb the nutrients from the foods that you eat and pass those to your baby. The downside of slow digestion is it can cause constipation. There is an episode of the Pregnancy Podcast that looks at solutions and remedies ranging from small diet and lifestyle changes to over-the-counter medications. And you can see that at pregnancypodcast.com/constipation. This week is an excellent time to examine some of your health habits. There are a lot of episodes of the podcast with evidence-based information on all aspects of health, including your sleep, your immune system, dealing with having a cold, the flu, or COVID-19 during your pregnancy, and exercising while you're pregnant. In week 7, you're probably gearing up for an appointment with your doctor or midwife next week. Hopefully, your partner plans to go to the appointment with you. Doctors and midwives are your expert resource for navigating your pregnancy. Do not be intimidated to ask questions. Remember, there is no such thing as a stupid question. For more tips on making the most of every prenatal visit, go to pregnancypodcast.com/appointment. Tip for dads and partners, you're probably going to notice that your significant other looks like they got a boob job. And they did. Their breasts are getting bigger. But the downside is their chest is likely going to be very sensitive and tender. So please ask before you touch. Thank you for tuning in to the 40 Weeks podcast. You can see a full transcript and all of the resources for this episode at pregnancypodcast.com/week7. Next week, your baby is going to start making spontaneous movements. And until then, I wish you the very best in your pregnancy journey.